This is Dr. Casey Anderson with North Texas Plastic Surgery, and this time we're talking about recovery from facelift surgery. If we're talking about facelift recovery, I tell people it's more social than discomfort. So if you're having full body makeover, definitely going to be focusing a lot on pain control in the early after surgery period. Here, not as much. We're going to be focused on some other things. So if you're having a facelift with me, we're very commonly going to do some other procedures with that, and we'll go over that too. But facelift by itself, I'm going to have you stay overnight with us at the surgery center. Couple reasons for that. First is surgery center, we have trained medical personnel in a medical facility that are very high quality medical providers that can take care of anything that might happen after surgery. That being said, I don't want that to allude to like there's all this crazy stuff that happens. It's not the case. But if you are one of the very tiny percentage of people that need a little bit of very special extra care, we have everything available that you just don't have at home. So after surgery, you're gonna be in a very chic and fancy head wrap that I will remove the following morning, and we'll take out your drain. 99% of the time we're gonna take out that drain. And we're gonna put you in something that's much less cumbersome. So when you're at home and you need to take it on and off to get in and out of the shower, it's gonna be a lot easier for you. But that head wrap, head dressing is very important to keep gentle compression on areas where the skin has been lifted and repositioned. One of the things you are going to be actively taking care of immediately after surgery is you're gonna have suture line along your hairline, in front of your ear, and behind your ear. That's gonna require a little bit of ointment that we put on, and the nurse who's taking care of you is gonna guide you on exactly how to do that, just to keep that incision line soft and supple so that the scar becomes just this razor thin line that hopefully just fades into nothing within a couple of months after surgery. So when you go home, you will have been taught that. You will have been taught how to take the head dress on and off. You'll have instructions when you can do your first shower, how you can wash your hair, how you can wash your face, all of those things. You'll have an appointment with one of my nurses the day after, because a lot of times what we have found is we've given you a lot of information prior to surgery and prior to discharge. And even though you've heard it, you've taken it in, you have it on your paper, you end up having a couple questions from just things you didn't even have any idea that you were going to encounter. So that appointment can clear up any of those small questions that you may have that you just want to get off the table. So then unless there's something that you need, which you'll have my phone number, you can call me. The next time we're going to see each other is around a week. At that week appointment, some of those stitches that we talked about are going to come out. Usually it's most of the ones that are in front of your ear. And that's kind of nice because it helps us see that we're progressing, and you can start to see that that scar is very fine line and it's already hopefully starting to fade really nicely. So the front of the ear stitches are coming out at a week. We're leaving the ones behind the ear. We're gonna have you come back around 12 days to 2 weeks to take those out, the ones behind the ear. Those are, if we take them out too soon, we can get potentially a little bit of scar widening, and we obviously really want to try to avoid that. Most of the time at that 2-week appointment, if you had had any bruising from surgery, that's going to have calmed down. And so what we're seeing is really nice contours, but we have still a fair amount of swelling in the face and neck. That is totally expected. Most of the time by the 3rd week check-in, a lot of the swelling has gone down and we're starting to see even more of the nice rejuvenated contours. And a lot of times we even see some improvement in the skin as well at that point. Now, throughout this process, if you've had a little more bruising for whatever reason than I would have preferred, we'll have you apply some gel that I will provide for you that helps that bruising resolve. And if that's the case for you, we will talk specifically about exactly what we want to do with it, for how long, etc. But we'll answer all your questions. That's not everybody, so it's not really worth getting into exactly right here. But if you need it, we'll talk about it. I'll answer any questions there. With facelift, it's really common to do other surgeries. The most common thing is some sort of eyelid lift or blepharoplasty, whether it's uppers, lowers, or both. As I mentioned, those have stitches. Those come out at that first week appointment, but that swelling is lasting, like I've already talked about, for facelift. You'll get other instructions at discharge as well about positioning of your head. So one of the things that happens during surgery is the skin is repositioned, and we obviously want it to heal in that new position with as few issues as possible. So big movements side to side and up and down could potentially inhibit that. So we're gonna limit those things. Like I said though, you're gonna get a really lovely, succinct paper of things to do and not do to help you along. So we're not throwing you out in there and you're stressed that you're gonna mess something up. We're not gonna let that happen. So the caveat to facial plastic surgery, especially facelift, in recovery phase is also something that we're gonna talk about prior to surgery, is when I'm doing a facelift, I am repositioning the deep structures of the face into a more youthful, rejuvenated position. Also, some skin is gonna be removed, but the skin itself, the texture of the skin, isn't really part of the deal, unfortunately. That is the superficial layer, and I'm working on the deep layer. So a lot of times we're gonna talk about things that can be done on the superficial layer to help you get a better result and aid in your recovery so that you're the happiest patient as possible down the line. So a lot of folks, we will recommend that you get some sort of laser treatment, usually a CO2 laser, that we will do both before and after surgery to maximize those results like I was talking about. We're really focused on recovery in this video. So what I'm gonna focus on now is talking about what to expect with skin care, not exactly surgically related, but skin care after surgery. So we've already talked about how to care for the incision lines. We're gonna use a really gentle cleanser on the face and patting dry. We're obviously not gonna rub anything. And then as time is going on, it's not terribly unusual to have some areas, especially right by the surgical incisions, where maybe we're getting a little dry skin or flaking skin. So a moisturizer is helpful for those, just so that you're not feeling like that uncomfortable dryness that happens. Sometimes people will use the ointment that I give you to care for the incisions for that as well. As things are progressing after surgery and some of the swelling is going down, unfortunately, sometimes we see those minor skin imperfections come back through. So it's at the 6-week mark after surgery when we'll talk about doing hopefully that second round of laser that helps with some of those surface level imperfections, that then if we're treating that and we've already treated the deep layers, really maximize your results and make the most youthful version of your face that we can possibly get. This has been Dr. Casey Anderson with North Texas Plastic Surgery. If you want more content like this, please let me know. You can like, comment, and subscribe below.